but had braces for like 100 years. So my jaw was pushed back, so they had to bring it forward.
Yeah, by looking at you, I thought for a second that you needed a little bit of chin. So you could, if you wanted to, play with that. So we're gonna do lips again. We have our wonderful patient Kat. She's gonna be our model today. She has never done any lip filler, so we have a virgin patient, which I love. She's getting married in September, right? Congratulations.
Thank you.
And she is not happy with how her upper lip kind of like disappears when she smiles, which makes us a good candidate for a lip flip, which she already had, a lip flip with toxin. So she had a lip flip with toxin, how many weeks ago?
It was back in April.
Okay, so it's long gone.
Yeah.
Long gone. Did you saw improvement? Did you like how it looked?
Yes, I did.
Okay, very good, very good. Whenever she smiles, her lip kind of like turns in, right? So she's a great candidate for a lip flip. And what I was explaining to her is because the filler is going to give her volume, right? It's going to help a little bit with that kind of like curling of the lip. But the recommendation, or at least what I recommend my patients, is to continue to do lip flips in between your fillers.
Mm-hmm.
Because that is going to control the muscle contraction, which is a completely different thing than the volume that we're treating today.
Okay.
So just continue to do your lip flip. Do one maybe 2 or 3 weeks before the wedding or something like that, so you can have it like going. And she's looking for a little bit of volume. She doesn't want anything crazy, right? And I was explaining to her that one syringe is never going to give you craziness, right? Especially when it's your first syringe. Your first syringe is always going to be your most natural look and feel, because you don't have anything there, right? Let's say you did the first syringe and you're like, I want a little bit more volume. We can definitely add a little bit more over that product, okay? And we will layer it, okay, on top of the product that you have. So at that point, that's really when you start seeing a little bit more of that volume or that buildup, okay, of the volume. So your first syringe is going to be super natural, super subtle, so much that some patients will come back, I don't know, 4 or 5 months later, and they're like, it's gone. It's not gone. The baseline is still there, but it's so soft and so natural looking that you may feel like it's gone.
Okay.
The product is indicated for 9 to 12 months. Okay. We have different products that we can choose for the lips. The one that we decided to use today on you, because of that curling of your lip, okay, it's going to be Restylane Kysse, which is one of the products from Galderma, okay, that it's approved for lips, and is soft, but at the same time gives you structure. So it's the perfect product to do that tinting technique, which is kind of like little lines that go this way, and they're going to hold the lip up, okay, and they're not going to let it curl in like it's doing right now. Okay, so we're going to do a mucosal block. So a mucosal block is not a true dental block. We're just going to block the mucosas, right? So, and I'll show you how to do it. It's going to numb the area without numbing the actual muscle contraction. So she's still going to be able to smile for us and pucker and all of that we need whenever we are doing lips. Okay, so with the mouth, right, the major vessels that we are trying to avoid, it's the superior and inferior labial artery, right, that branch from the facial artery right here. So kind of like there and there. And then the first little branch that comes into the lip, it's kind of like in between that vermilion border. And then it just branches like this. And we have so many, right, little vessels right there. We are very superficial when we are injecting lips, so it's really not an issue, I feel. But something that I've seen in the past is patients with very superficial arteries that you can even see through the skin. So remember that the artery, it's gonna run deeper. So it should run kind of like close to the mucosal, the wet to dry border, okay? Let's say Kat was telling me that she had done lips in the past. And she tells me, oh, I haven't done lips in 3-5 years. Even if she hasn't done any lip filler in the last 3 or 4 years, whenever the patients tell me that they have done filler, I always check the lips, right? I always palpate, because most of the time patients don't even remember what type of product they did. So you never know. It might have been a product that it's like I don't know, Melafil or something, right? You never know. So I always palpate, right, for the lips that they feel nice and soft, that you don't feel any bumps, that you don't see any migrated product that you need to work on before starting, right? And then I always check the wet to dry border. So when you flip the lip this way, sometimes, and you probably have seen it before, you guys have probably seen it before, you can see kind of like a ridge of product, kind of like held in the wet to dry border. I feel whenever the injector gets too close to that wet to dry border, there's kind of like a little area where that product kind of like tends to pull, and then it doesn't go away. So it's been years and years and it doesn't go away. So if you see any product in that wet to dry border, I feel like the best way is to kind of like dissolve it before starting. Because if you try to inject, even if you are not getting close to that wet to dry border, if you try to inject, it's like having an open door. It's kind of like when the patients have product migrated to the skin on the upper lip, it's having an open door. If you try to put product in there, it's just going to travel to the area of least resistance, right? Which is where that product is, either in the wet to dry border right here, right on the border, and it can be in the lower or the upper lip, or the skin on the top lip. So the arteries, whenever you're injecting, always kind of like flip the lip this way, the lower lip, because in some patients, you're gonna see the artery kind of like right here, pulsating. For some patients, it's more superficial. And again, it's closer to that wet to dry border that we need to stay away from anyway. So remember, inject on the pink of the lip, right? On the dry pink of the lip. Don't get too closer to the wet, okay? Okay, perfect. Let's erase all these lines. So let's do the dental block. It's going to be a tiny injection. I'm going to do actually 4 tiny injections, okay? And it's going to be on the inside of your mouth. Go ahead and do like this. Very good. Bring this in here. So for the bottom, we want to aim for that foramen, okay, for that dental foramen that we have kind of like a line with the canine. So right where you see that canine, you're going to go in with your 30 gauge, and it's going to be maybe like a quarter of the needle, okay, it's a 1/2 inch needle, so a quarter of the needle, and then you're going to push maybe like a 0.05. Here we go, okay. Beautiful. If you need a break, you let me know, okay? How was it?
It wasn't bad.
Not too bad. We have consents, we have pictures. Okay, super now?
Mm-hmm.
Okay, this way. Okay. You can taste it.
Mm-hmm.
And for the upper, we're going to do the same. We're going to aim for that canine. Okay. Perfect. So since we're doing the mucosa block and she's going to be super nice and numb, I normally, whenever I use the numbing cream, I will start with one little retrograde injection, kind of like on the vermilion border, to give him a little bit of the numbing effect too. And then do the tenting. But since she's going to be super nice and numb, we're going to start with the tenting because she needs the most lift or the most flip out of that lip. And we know that the tenting technique is the one that gives us the best flip. We already talked to the patient and explained to her it's one of the products that we have approved for lips from the Galderma family. It's a great product. I really like Kysse. I use it every day because it's soft, but at the same time, it gives you enough structure to kind of like flip the lip. I feel is the best product for that tenting technique for sure. It's kind of like the perfect combination of softness and structure. And it's so soft, I really like it because patients never complain about any bumpiness or anything like that. I have no issues with it. And it comes with a 30 gauge needle, which we're gonna be using. I don't transfer my product to insulin syringes. I know some injectors do. I'm just so used to using the original syringe, and I'm OCD with the cleanliness. So I feel like whenever you transfer product to the insulin syringes, there's always a risk, even if we're super careful, there's always a risk of cross-contamination of the product, and the product is sterile inside of the syringe. So there's different ways of doing the lip flip with toxin, right? So I feel like that old version, okay, because remember that the muscle that we're targeting whenever we do the lip flip with toxin is the orbicularis oris, right? The one that is surrounding the mouth, and it's a round muscle, right? So what I explain to my patients is a round muscle, and it's the muscle that it's kind of like keeping your mouth closed, and because of that, it's the one that it's making you kind of like scrunch your lip like super, super tight. So it's the one that is giving us those little fine lines, right? But at the same time, when you smile and you turn that lip, right, there's also the possibility of doing a little bit of both, doing the gummy smile and the lip flip for her, since she gets that little turn whenever she smiles. So how I do my lip flip is I have my patient pucker or blow a kiss, which is going to be kind of like hard for her right now because she's so numb. And wherever I see the deepest lines, wherever I see that muscle pulling with the deepest lines, I do a tiny little dot right on the vermilion border, exactly where I see those deeper lines. Because what we are trying to avoid is those lip lines, right? Or we're trying to kind of like, and that's how we release that lip and we cause that little turn or that flip. So, and I do both up and bottom lip. I feel it looks beautiful and patients love it. So that's kind of like what I do. And I do 2 units on each little dot. That's it. Super easy. Okay. And the other way of doing it that I've seen some injectors do it, which is kind of like the old way of doing it, I feel, is whenever they inject the orbicularis oculi over here, kind of like almost like in between the nose and the vermilion border on the skin right here. I feel that takes so much movement away that sometimes it kind of like changes their smile a little bit. So I try to stay away from that one unless it's like a 60-some-year-old patient or 70-year-old patient that really, really needs those little lines to be targeted. That's the only reason that I will do that one. And you do it with a tiny, tiny amount. I don't think I will even do the 4, like the 2 and 2. I will do maybe 1 and 1. So just like the tiniest amount, because this technique tends to take a lot more movement away than the one on the vermilion borders. Are you numb? Yeah. Mm-hmm. Super numb? Mm-hmm. Okay. Since we're going to start with the tinting, let me do the little lines that I normally mark. So everybody's lips are going to be a little bit different, and we have to kind of like be aware and respectful of the natural proportions of the patients. So 2 little lines from the ala of the nose, right, which is the same as inner canthus, right? So inner canthus, ala of the nose, 2 little lines all the way down, and it's going to be the same width as your chin as well. So I always mark those because remember that this medial section is where the volume of the lip is supposed to be. And I always like to mark the midline too. She has a beautiful little cleavage right there, natural. So she has the 2 little pillows on the sides, right? And the little cleavage in the middle. We're not gonna erase that. That's beautiful and it's staying there. See how your lower lip has like a little pillow right here and a little pillow right there. And it almost has like a little cleavage right here, like a little indentation. That is beautiful, okay? It's how the natural shape of the lower lip is supposed to be. So we're not gonna erase that little cleavage. You're probably gonna see it a little bit more enhanced actually. And that's beautiful. It's like the cleavage of the boobs. Remember that when you're doing the tinting technique, just be careful that you're going in the pink and not on the white border, okay? Because remember that when you come out on the tinting technique, you want to see a tiny little bit of that product left at the end. So just be on the pink, because if you are on the white, you're gonna end up having some product kind of like outside of the border. Okay. Here we go. Let me know if you need a break, okay? That's all you can do. Awesome. Tiny little things. We did a 0.2 right there. So I don't look at the syringe anymore. I feel like it's already engraved in my brain, the amount that I need to push, but I'm always looking at the tissue. I feel that's the best way. Just pay attention, obviously, before I go to the other side, I always pay attention of how much I did so I can keep it kind of like evenly distributed. That looks beautiful. And she's okay with having a little bit of volume, so we're probably going to use the full syringe. So we're planning to do another 0.2 on this side. That's good. Thank you. How was it? Good. Not too bad?
No, I didn't feel it.
0 to 10. 10 being the worst pain
Like,
ever.
maybe a 1.
Okay, awesome. Beautiful. Love it, love it. Perfect. Yeah. You let me know when you're back. Beautiful. Now, I'm going to sit her up, and we're going to start working on the bottom lip. And I will come back and do a little bit more on the top. It's really good. Really good. You're going to love it. Okay, I'm going to sit you back.
Okay.
I'm going to do my pillows like I normally do. Okay. So I'm going to do 2 little lines retrograde. Okay. Remember the line, right, that we need to kind of like stay kind of like respectful of. So we're going to go in kind of like where the little line is, and then all the length of your needle, which is 1/2 inch, and then retrograde, and then fan it, and then retrograde. So like a little V, okay, 2 little lines. Here we go, Kat. You're doing great. Little book, beautiful. I did a 0.1. And I'm planning on doing a couple of lines too. Okay, nice and little V. That's great. So now I'm going to do a couple of lines for the tenting technique, but for the bottom lip. So what we're doing is kind of like this, little lines. Maybe 3 on each side, something like that. So we're going to come in, same thing on the pink, right? Go in, stay superficial, and then retrograde a little line. Being respectful of your midline. We're not going to add anything into the cleavage. Still gonna keep it small. We'll do it right now. So a couple of little lines. You see how you can see that little droplet? That's what you're looking for. but you have to be on the pink. Oh. And we did there almost a 0.1. And she was really symmetrical too. But if you have somebody with asymmetry, which is really, really common, obviously, let's say one side was smaller than the other, well, you can play with doing maybe 4 lines on one side and 5 on the other. Just add a little bit more volume where she needs it. It's a great way to kind of like even out little asymmetries. And I explain to my patients that the lips are never going to be perfectly symmetrical. There's no perfectly symmetrical lips, so don't even pay attention to those little things. A little line of volume on the kind of like a retrograde line close to the vermilion border, and then save a tiny little bit for the corners. We are at 0.75, almost 0.8 right now. So I'm going to do a tiny little bit of the Cupid's bow, just to give it a little bit more sharpness. And I'm doing that little technique that I showed last time. It's just the bevel of the needle right where the peak of the GK point is, just to give her a little bit of support right there. Now she's super numb, so she's not going to feel anything out. And then I just mold it kind of like a little triangle. Okay. I know you're super numb, but try to give me a smack. Perfect. Love it. Ooh. You're going to like it. It's not curling as much as it was doing. Okay, I'm going to do a tiny little retrograde line on the pink of the lip. I normally kind of like pull with my fingers so I can see a little bit more of the pink. And probably like a 0.05. We have a 0.2 right now. Beautiful. Nice and superficial. 0.5. Nice. I don't even want to touch it. Perfect. Looks so good. Same on the other side. We have a 0.1. I'm going to use probably like a 0.05 for the corners. I like to add a little bit on the corners. I mean, she's so young and she doesn't have any drooping, but just lifting a tiny little bit on the corners makes the lips so cute. It's just kind of like framing the lips. So beautiful. Okay, turn this way. And the way that I do it is I'm standing on the opposite side that I'm treating, right? And then I'm pulling on the skin the way that I want the skin to go. So don't pull this way, pull this way, pull up. And then I do a little line right on the mucosa, okay? So you want to see the little volume right there on the mucosa. And then I do like a little V. So a line right there, a retrograde, and then another retrograde right there. I found it. Beautiful. Nice and bright, nice and bright, nice and bright. Beautiful. Right on the mucosa. Just pulls the corner of the lip. So cute. So cute. And it's such a tiny amount of product that I feel it serves better in that area than it would on the lips. On the lips, it's not going to make a huge difference because it's just a 0.1. But on the corners, it just lifts everything and it looks so beautiful. I helped you. You see that little, just that little lift right here in the corner? Looks so good. Are you happy? They look really, really good. Okay, hold it for me. Okay, very good. Last one. Okay. So pull the skin, right, like you want it to go, kind of like up. And then right on the border, right on the mucosa. You're gonna add probably like a 0.05 and then like a little V. So kind of like a little V this way, right there. One on the mucosa and then another one right there. That looks so good. So good. Now that product, the one that I did first, right? That little line that I did first, it's right on the mucosa of the lip. So you're probably gonna feel tempted to be kind of like touching it like this.
Perfect.
Because you're going to be able to feel it, okay, for the first couple of days. That's super normal. Don't worry about it. And you're going to be able to feel the product anyway for the first couple of days. It's going to feel like a little bit lumpy, bumpy. Super normal. Don't worry. It's not going to stay like that. It's just a little bit of that swelling that the body creates in the beginning. Okay? Beautiful. Okay, that's it. We're done. Let me mold it. Like I said, you're going to feel a little bit lumpy, bumpy, okay, for the first couple of days. It's completely normal. It's just the swelling that is there, okay, creating, like the body creates a little bit of swelling surrounding the product. Don't mold it, don't massage it, don't touch it, don't play with it, don't do anything to it, okay? The product is going to settle on its own, okay, and it's going to integrate into the tissue, and then you won't be able to feel where it is, okay? So just let it be, okay? I know you're going to feel tempted to, but try not to kind of like mold it or play with it because the product is so soft that we could kind of like take away a little bit of the volume or the lift that we are creating if we try to play with it too much. No eating or drinking during the first hour, okay, remember, because you're so numb that you're going to bite yourself. After that, just don't wear any lipstick or any lip gloss for the first 4 to 6 hours. This that I'm using is bacitracin, which has a little bit of an antibiotic on it. It's kind of like Neosporin, so it's kind of like protecting you a little bit. Just try not to do any lipstick or lip gloss. Try not to be leaking in, okay, for the first hour or so. So remember, a little bit of bruising, a little bit of swelling, a little bit of tenderness, completely normal, okay? What is never normal is pain, okay? If something hurts, you have to let us know right away. If something is excessively swollen or excessively bruised, okay, or bruised where we didn't inject. Let's say we did the lips, but you're bruising on your chin, your nose, that's not normal, okay? So you have to let us know. Everything looks amazing, okay? If something's going wrong, we normally know right away. Everything looks great, okay? But just letting you know. Who knows, you may want to add a little bit more before the wedding. I always tell my patients, get comfortable with this product, okay, before thinking about adding anything else. At least if you were like in a hurry and you wanted to do more, you could at 2 weeks, okay? Once the swelling is gone, the bruising is gone, product is settled. But ideally, I normally tell my patients to wait a full month before adding anything. And that is going to let that product that we just did settle in, right? And it's not going to give us as much risk for that traveling or that migration of the filler.
Okay, awesome. Well, thank you.
You're welcome. You did so good. So good. You're such a great patient.
It didn't really hurt. There's like a few points where I was like, oh, I can feel it now. Like on the outside, like when you were doing right here.
Yeah.
But other than that, it felt really
beautiful.
I mean,
and if you see how she's talking and everything, she doesn't have any involvement of any muscle. It's just mucosas that are blocked with that technique that we showed. Give us a big smile. Yeah, she's smiling perfectly. Yeah.
Awesome.
It looks so good.
I love them. I do.